we're very grateful to all of our funders, and particularly the Stollery Children's Hospital Foundation that since 2007 has funded an endowed chair in autism research that has been really a substantial part of what's allowed us to operate our Autism Research Centre, to work with many of you, and to advance some of these important topics. So really grateful to the foundation. So in the spirit of what I said in terms of selecting topics that were of interest and identified as priorities, I'll talk a little bit today about autism and attention deficit hyperactivity disorder. I want to acknowledge that the title also had a third term, ODD, which stands for oppositional defiant disorder. I won't talk a lot about that specifically. I'll just mention that that condition is kind of a pattern of resistance and argumentativeness and holding grudges. To be honest, there's actually very little research on that sort of diagnostic term among autistic individuals. I think it's kind of very difficult to entangle. It's not the most kind of neurodiversity friendly concept because it kind of situates that kind of resistance and conflict within the individual and doesn't really fully take account of the context or the relationships. The truth is, in non-autistic individuals, oppositional defiant disorder is really very common, a common co-occurring diagnosis with attention deficit hyperactivity disorder. So really the support and management strategies that I'll talk about in relation to ADHD apply to ODD, so it's probably not worth mentioning it further. It was fun to kind of think about this topic. It's certainly one of the most common questions that families have when I have a chance to see them in the clinic is around attention and possible attention deficit hyperactivity disorder. I think it's really important to reflect on sort of the things that can impact on our attention span, because ADHD isn't necessarily the top of the list, for all of us, and including autistic individuals. Things that affect our attention span are if we're kind of in physical or emotional discomfort, if there's been a communication breakdown, or we're kind of in a learning situation that just kind of isn't a good fit for our needs. So, I may be relatively focused today as we talk about this topic and other autism-related topics, but if you put me in a graduate class on nuclear physics, I would have no clue what's going on. I wouldn't feel prepared, and it would be a lot harder for me to feel engaged and focused in the material, and I wouldn't understand a lot of the terms and vocabulary. So the context is certainly really important to think about when we're trying to make sense of people's attention. And frankly, maybe what affects our attention span is just maybe things are more interesting in our minds than what our communication partner is talking about. So again, that's another really important kind of overall factor to take into account. So I'll talk about some kind of key questions so what is ADHD or attention deficit hyperactivity disorder? How common is ADHD among autistic people? What are some of the features of ADHD in autistic people? And I think one of the biggest clinical challenges that we have when we're addressing the question is actually disentangling what's specific to ADHD versus kind of what might be related to autism itself or related to that environmental context. And then I'll also talk about some support strategies. What we can kind of draw from the ADHD literature, what we need to consider in terms of that broader context of when ADHD is combined with autism, and more broadly, how do we need to approach the general question of supporting attention and engagement among autistic individuals, including autistic students. So ADHD, like autism, is defined within our diagnostic dictionary, the DSM-5, and it is a behaviorally defined condition, which can make it challenging because it doesn't fully take account of the environmental context. Like autism, there are a number of specific features which I'll describe in a moment. There are two broad categories of features. The first that relates to inattention. Part of inattention is planning and organizational skills. And then the second broad category is hyperactive impulsive. And People can receive a diagnosis of ADHD if they have mainly one set of features or the other, or a combination of the two. And the way these features manifest changes with age, and also maybe somewhat different between males and females. And there may be important sex and gender differences, which I'll speak a bit about more in detail. Here are the specific features of inattention and hyperactivity impulsivity. I'll give you a moment to kind of scan these features. So this is what's listed in the DSM. So I think it's important to take into account that this condition was largely described based on school-age children, and school-age children that did not have other specific diagnoses. So these are largely children who were not developmentally delayed, who did not have other specific conditions such as autism, but rather sort of largely school age, kind of more boys than girls. And so I think that often the clinical picture of ADHD is really sort of based in that somewhat narrowly defined group. So being easily distractible, having difficulty sustaining focus, kind of losing and misplacing things, being forgetful in daily activities, not seeming to listen. So this constellation of difficulties with sustained attention and kind of maintaining a focus when other things are going on. And then the second broad category relates to activity level and impulse control. So that can range from just general restlessness, like having difficulty sitting still. It can relate to kind of more overt high activity level, running around, having difficulty kind of maintaining your own body in physical space. So like bumping into things and grabbing things. Having difficulty playing quietly or modulating voice kind of in conversation. Difficulty knowing when it's time to enter a conversation. So blurting out an answer or kind of being perceived as interrupting a conversation. And the idea of impulse control is being able to think through one's options before acting. So to other people, it may seem that the individuals are kind of acting without thinking. As you reflect on all these features, one can imagine how the features of autism might contribute to the appearance of some of these features as kind of defining features of autism rather than as needing to consider a co-occurring diagnosis. I'll also acknowledge that that in ADHD, perhaps even more so than in autism, there's heavy reliance on the reports of the people that know the individual. So that includes parents and teachers. So again, they're tending to rate these features kind of at face value rather than taking into account sort of the individual, sort of the multifaceted aspects of the individual and the environmental context. This is a really nice infographic that was actually published by an autistic professional and kind of covers some of the key relationships between autism and ADHD and sort of the broader context. So ADHD and autism are frequent co-occurring conditions. So there have been a number of studies looking at rates of ADHD using different methodologies. And again, varying to what degree they rely on sort of external report and questionnaires versus kind of the judgment of an experienced clinician. So that's why one gets these kind of quite widely varying percentages of say 20 to 80%. Probably the best designed studies find that the rates are about 30 to 40%. So certainly very common. And then the flip side is true as well. So a number of studies have looked at rates of autistic features among people diagnosed with ADHD. And there are a smaller number of studies that looked more formally at rates of autism diagnosis. So in one large community study, a rate of about 13% was cited, so about 1 in 8. So combining those two features, if we think about roughly 2% of the general population being autistic, then about half of those, or perhaps 1% of the general population, is both autistic and would meet criteria for ADHD. It's interesting that in studies that have looked at not only individuals, but also their siblings and the broader family, there are certainly co-occurring rates of the two conditions. So it's not uncommon for us to meet families where one child is diagnosed with autism and another child is diagnosed with ADHD. And they may, and meeting the two individuals, it may not be so clear that they have distinct conditions. And it's interesting that when we sort of when we keep an open mind and don't place people kind of in distinct categories, there's a tremendous amount of overlap in terms of kind of lived experience as well as the specific challenges experienced by the two groups. There are also kind of reasons to think there's some overlapping biology as well. So a number of studies, including great colleague Evdokia Agnostou in Toronto, really find that the specific genetic factors and even some of the brain development differences kind of very much overlap among individuals with the two conditions. It's really important to acknowledge that until the latest set of diagnostic criteria were published in 2013, so that is the DSM-5, there was actually kind of a rule against diagnosing the two conditions in the same person. And perhaps partly for that reason, we haven't really seen a lot of research done sort of on individuals that have both diagnoses. But it's also kind of sobering that even after 2013, there has not been sort of a marked uptick in research that really looks at individuals with both conditions. So I want to acknowledge that a lot of what I'm talking about today largely comes from clinical experience, comes from lived experience from families and individuals, or also comes from kind of extrapolating from the experience of autistic individuals or the experience of individuals with the diagnosis of ADHD. So there's still a lot that we need to learn about what it really means to have both diagnoses and how do we meaningfully disentangle the features of the two to really think about when it actually makes sense to add a second diagnosis. So one can approach this kind of based on our understanding of the criteria and talking to individuals and families. So on this, so there are certainly some common challenges that are shared by the two groups, but they may be driven by slightly different factors. So certainly individuals with ADHD as well as autism may encounter struggles in personal relationships, including peer relationships. Kind of at least the stereotype is that for autistic individuals, this may relate to perspective taking. So thinking about the unspoken perspective of the social partner, or kind of having an understanding of sort of what the unspoken rules are, sort of the kind of the expectations of a non-autistic individuals and trying to navigate that and make sense of that. And to some extent, relationships, it can be a challenge when where people are experiencing social anxiety and may have difficulty with kind of initiating and making that initial approach. Whereas, kind of stereotypically, individuals with ADHD are described as having difficulties in social relationships because of that impulsive approach, kind of being a little bit larger than life, kind of jumping right in, sort of not sort of taking the time to kind of ease into an interaction. I think for this and for all other things, this is a bit of an artificial distinction, and certainly there are many autistic individuals that also experience difficulty knowing sort of when it's the right time to kind of jump in or make a comment, and individuals with ADHD, in part because they may have had social challenges growing up, may also have some difficulty with perspective taking as well. These kinds of features affect conversational skills, but again, although the textbooks would suggest kind of one set of challenges for one group and one set of challenges for the other group, the reality is they're they're considerably overlapping. And likewise for planning and organization and those broad sets of skills that fall under the general category of executive functioning. Although stereotypically, autistic individuals would be described as having difficulty kind of shifting ideas, whereas individuals with ADHD, the focus would be more on that impulse control, sort of like shifting topics too quickly. The reality is that often these kinds of challenges co-occur in both sets of individuals. And the other thing that complicates the assessment and trying to make sense of these diagnoses at an individual level is that both ADHD and autism also often go along with not just the second condition, but also multiple other conditions like anxiety or mood difficulties or physical health issues. So it becomes very difficult to disentangle sort of what specific features are being driven by what diagnoses. Autism is also a condition that's defined by a constellation of behavioral features. And when we think about the social communication features, as well as the features related to having intense interests, having difficulty kind of shifting or preferring things in a certain way, the manifestations of those features can look a lot like ADHD as well. It's interesting that, as I commented earlier, when one doesn't make sort of, when one isn't aware of a diagnostic category and doesn't sort of filter what we hear from an individual or their family sort of based on that expectation of a particular set of features related to a diagnosis, there's a lot of overlap. So this is a study that was actually done by Evdokia Anagnostu's group, the Province of Ontario Neurodevelopmental Network. So they essentially had a group of children and youth kind of diagnosed through the clinics, one group with a primary clinical diagnosis of autism and one group with a primary diagnosis of ADHD. Now, I'll acknowledge that they did not look carefully at whether both sets of criteria were met at an individual level, but rather they just were looking for people who identified based on a clinical diagnosis of one or the other. They assessed the two groups with the same set of measures. A lot of these measures were by parent report or by teacher report. And one set of measures focused on autism features and the other set focused on ADHD features. Whereas the group with autism definitely had a higher level of autistic features relative to the group that had a primary diagnosis of ADHD. It's interesting that the two groups actually had the same average level of ADHD features. So that has two possible implications, and they both may be correct. I mean, one is that it may actually be difficult to distinguish the manifestations of ADHD, when there's already a diagnosis of autism, or it might be that ADHD is just very common among autistic individuals. But it may be a bit of an artificial distinction to talk about autism with and without ADHD. It's probably much more of a continuum, and broadly, these features are very common. Another interesting observation is that although having multiple diagnoses can kind of be helpful for individuals and families and support clinical management, sometimes we get a bit too caught up on focusing on one diagnosis versus another. And there's a phenomenon that's been described as diagnostic overshadowing that can sometimes delay a diagnosis of autism. So this is an interesting study that came out of the Netherlands. So a large group of individuals, over 1,000 children and youth and over 1,000 adults. And these are individuals that agreed to participate in a number of research studies based on a primary diagnosis of autism. So all of these individuals were also assessed for ADHD, and in particular, whether they had received a clinical diagnosis of ADHD and whether that clinical diagnosis of ADHD had been received prior to the autism diagnosis or afterwards. So overall, in this group, actually a somewhat lower rate of ADHD diagnosis that has been reported in other studies. But it's interesting that among the children and youth, that if they had a prior ADHD diagnosis, they were actually diagnosed with autism later. And this was particularly pronounced among girls. So it's not, and this is actually something that we see in our school age clinic quite frequently, that a child has kind of a complex, kind of multifaceted set of differences that relate to their interpersonal life, their academic life, their family life. And as I said, the features of ADHD and autism can overlap. So sometimes if those kids receive a diagnosis of ADHD, there's a risk that people stop thinking about autism. And that may very well have contributed to the delays in diagnosis. As I mentioned earlier, like in autism, there are some important sex and gender considerations. One of the things that ADHD shares in common with autism is that it's much more frequently diagnosed in boys and men than it is in girls and women. Although it is interesting, as in the previous study, that the balance is shifting sort of for individuals diagnosed in the adult years. But certainly for school-age children, there are many more boys that are diagnosed than girls. That may be partly related to kind of a genuine difference, but it may also partly be related to kind of the biases and kind of narrow perspectives that we have as clinicians, in part because of the way we're taught, and in part because the way that the conditions are defined in our diagnostic manuals, because again, they're largely defined based on clinical experience in boys. So when boys and girls with ADHD are looked at from kind of in more of an open-minded way, there are some genuine clinical differences. So I mentioned the two sets of features. Girls with ADHD tend to have the inattention disorganization as the primary set of features versus impulsivity and hyperactivity. So clinicians kind of, when they think about ADHD, they're often thinking about people who are hyperactive, bouncing off the walls, but that does not characterize the full spectrum. And because of that, girls with ADHD can be overlooked because some of the manifestations can be a bit more subtle, and it may, and there may be these kind of attributions about just kind of not being motivated, not being organized, being overwhelmed for other reasons. Girls with ADHD can have difficulties with impulse control, but they can look very different. They may not be that overt motor hyperactivity, but rather kind of, talking more quickly, blurting out answers, or and having difficulty with some of the subtle social cues in terms of knowing when to kind of enter an interaction. And like in autism, there's been a description of efforts to kind of mask or compensate. It's interesting that ADHD is also very common among gender diverse youth. I'll briefly mention that in terms of supporting individuals with ADHD with or without an autism diagnosis, we need to consider the broader context. It's important to optimize the learning environment. For autistic people, this certainly includes considering sensory aspects of the learning environment, ensuring that the learning plan and the supports in place align with the child's strengths and interests as well as needs. There's a large part of supporting individuals with ADHD is making sure that the people around them are providing appropriate supports and structure. Particularly for parents of children with ADHD, there are structured kind of educational programs, many of which are available online. There's a common program that we recommend for autistic patients and their families kind of shortly after diagnosis, which was actually developed primarily with the needs of children with ADHD in mind. So the Triple P parenting program. And it's largely about kind of creating structure, expectations, predictability, and taking a strengths-based approach to helping kids kind of manage those symptoms. And then medications can be helpful. The medications that are used in autistic people with ADHD are largely similar as those without autism. And the most common medication used in ADHD in non-autistic individuals is also effective. For autistic individuals, it's not something that we jump to without considering all these other factors, but it can be helpful in reducing some of the features. One of the positive features of Ritalin is that it acts quickly and it's gone from the system quickly. So it's something that we can evaluate in a short time. And then there's a great decision aid, along with other toolkits offered through Autism Speaks for free download to help families kind of with that, make informed decisions about considering medication.